taking 50% E1 and 50% E2. So E1, again, is the bad estrogen. So you're taking half of the estrogen, the one that actually is linked to breast cancer. When you take bioidentical hormones, we usually give 80% E3 and 20% E2 mixture. We never give E1 because we're always trying to do it so that you're functionally better, you're feeling better, you're more healthy, but you're safe. It's a safe way to do it. So that's the reason why we do it that way. So any questions so far? I know I've been talking a lot. And
is it only for perimenopausal women, or can you use it for younger women as birth control as opposed to?
Well, you can't. It's not for birth control. But I mean, younger women we find, especially women who have things like PCOS, which is polycystic ovarian syndrome. Women with that condition actually have low estrogen and high testosterone. So for women like that, yeah, I mean, we start seeing women who start losing their hormones in their early 30s, especially their progesterone. And it all depends upon what we find in the blood test that we do, the special test that we do. If we find that you are low on one hormone and you're okay on the other one, we try to balance that, and that makes things correct. So we can give you the right dose because we give it in a cream that we could change the dose, we could manipulate the dose correctly so that we fix it. Yeah.
Personally,
Yeah.
sorry.
Yeah.
I found it odd when I went to my OB/GYN,
Yeah.
and there was no test performed of any sort
Right.
of any imagination,
Right.
blood testing,
Right.
take this.
Right. And I'll tell.
And knowing, not even a conversation,
Exactly.
so I'm completely intrigued by this whole
Yeah.
thing, learning so much in the last 15 minutes.
Yeah.
But I was happy to hear you say that there is some sort of a test. That
Now let me tell you why. That's an excellent point. I'll tell you why. Because when you take oral synthetic hormones, which is mostly OB/GYNs are going to give, right? You cannot test it in the blood. Why? Because it's synthetic. It doesn't function the way that your body does. So you can't even find it in your blood. You take it, you don't know what you're taking. Your body is not going to recognize it. When you take the bioidentical hormones, we know exactly how much you have in your blood. We know how much we need to give more or less because it's functionally the same, it's chemically the same. So we always start off by testing, we see where you're at, and then usually within 3 months, we retest again, and we kind of see where the numbers are. It's not an exact science, but what it is we customize it for every person. Everybody's different, everybody metabolizes things differently, but we want to make sure that what we're doing is the best thing functionally and the safest for you. Yeah.
Is this something, this type of treatment, which sounds very appealing to me personally, is it covered by insurance? Or
The hormones are covered by insurance. The lab work is covered by insurance. The actual office visits, because of the fact that we take so much time. Usually I'll start, by looking at your test, I'll put about 2 hours into a plan for you, and then we sit down for an hour or so in the office. So, insurance won't cover, those costs. But otherwise, we also in the office do, submit insurance claim. We'll give you insurance claim to submit, and we've had patients who have gotten a good reimbursements back. So, so that's kind of where we're at. But unfortunately, this type of medicine is something that's very special, and unfortunately, they should recognize it, but medicine doesn't. So, any other questions so far? Okay. So the last thing I'm going to talk about is something also I'm very passionate about, and this kind of what drew me into what I'm doing here with you today. So when I talk about the way that medicine is performed today and the way that we perform it at our office, it's very different because, again, what we have today is what we call protocol medicine. So every single person that walks into the emergency room with any single problem, for instance, they will get the exact same thing regardless of who you are, what the problem is. And this is the reason why I looked at it and said, this is a problem because everybody's different. Everybody has different either genetics, nutritional balance, or hormonal balance. And this is what we look at. So I'm going to go through a bunch of different scenarios and slides with some of my patients and tell you a little bit about what we do. So, the one thing you could go home and do this at home. Low thyroid is something that's endemic in the society. And what I mean by that is that a lot of times you will go to your doctor, you will know that you have symptoms that seem like you have low thyroid, yet he'll say you're fine. And this is the reason why. The reason why is that the tests that need to be done for low thyroid are at least 4 or 5. And usually, conventionally, they'll do 1 or maybe 2. And the problem is that you're not looking at the entire panel and the entire patient to be able to come up with the answers. So I'm going to give you a little bit of stories about some of the patients that I've had that we fixed that we found that actually are functionally low thyroid. So thyroid problems, weight gain, depression, fluid retention, cold intolerance, depression. And one thing you could start looking at your clients or people you know, if you look at their lateral third of their eyebrow, if they have loss of their lateral third of their eyebrow like this woman does, that's like definite thyroid. Regardless of what the lab show, that's definitely a thyroid problem. So also another thing that we found is that joint pain, brittle nails and also brittle hair are all related to thyroid. So when I'm going to talk a couple of conditions that are commonly treated by conventional medicine as kind of psychiatric disorders, they actually are usually something more like thyroid. So there was a study done in Colorado, and they found that 13 million people, and this I think is on the low end, have thyroid condition that are undiagnosed. And again, the reason is because when you look at the entire picture, you have to look at all the blood tests, and these tests are available. They're not like some random kind of test out of nowhere. They are available, but if you don't know how to use them and properly take them and put the whole picture together, you won't do them. So, for instance, for thyroid, you need at the very least 4 blood tests to look at the thyroid function, because thyroid in itself, the T4 hormone, for instance, is just a hormone that is the pro-hormone. It kind of gives the hormones their power to move on. And the T3 is the actually active hormone, the one that actually works. So when the doctors give you Synthroid, they're giving you only T4 hormone. And so a lot of women tell me they've been on Synthroid, they know they have the thyroid problem, yet they're not getting better. And the reason is because they're not converting their T4 hormone correctly to produce the active hormone. So when we put them on natural thyroid hormone, which has both T4 and T3, all of a sudden things start to get better, because of the fact that there's a lot of things that go into this picture, and unless you understand it and kind of look downstream and what each hormone is doing, you won't be able to get it. So fibromyalgia, chronic fatigue. Recent story, I had a woman who came in, she's been on multiple pain medications with chronic fatigue. She was just put on multiple psychiatric meds. She basically came into the office just saying, I don't know what to do. I looked at her blood work and I said, it's thyroid. It was clear to me, looking at the picture. We put her on the natural thyroid. Within 3 weeks, all of a sudden, she got off all her pain medicine and she's weaning off the depression medicine. And that's our goal. I mean, our goal is to actually look at the person. And the beauty is that now with the science and the research that have been done over the last 10 years, we have the science to do this, but not enough people are doing it. So in our anti-aging practice, we actually are using the science that is most cutting edge and looking at it and fixing the problem. So that's the real beauty of it. MS is another thing I kind of mentioned earlier. Like I said, go on our Facebook page and take a look at some of the articles I have about MS, and one of the last articles we had, about 30,000 people comment on it, and it was specifically about the studies showing that women actually decreased their plaques. Not only felt better, but they looked at the MRI and they saw the plaques, the MS plaques, which caused the problem, start disappearing. And this was studies done in UCLA, and you could go online, Google that as well, and you could see incredible things they're doing with E3 estrogen. And the way they figured it out is that women who are pregnant have less exacerbations of MS. And they're like, what is the difference? And the difference is they produce more E3 estrogen. So a lot of these things, like I laugh about because we learned in medical school, you know, when women are postmenopausal, they have a higher risk of heart disease. But they never explained to us why. So when you put the pieces together, hey, because you have low estrogen, you're at increased risk of developing high cholesterol, high blood pressure, heart disease. But no one ever put that piece together. And these are the pieces that we put together in the office to kind of try to make everything right. Now, stress. Now, I know anybody who's an employee here at Mosaic does not have any stress. That's what Katrina told me. And so I'm going to leave the rest of the people who don't work here. So basically, no, but stress is stress is important as well, because the stress hormone is called cortisol. Cortisol is a hormone that's really important when you're running away from a lion. Because if you're running away from a lion, which, you know, I don't know if there's too many, it's great because it actually increases your blood sugar, so your brain energy gets better. It decreases all the other functions of your body, your hormones, your immune system, all go down because you're focused on getting away from that lion. Now, if you're running away from a lion for 20 years, well, that is the real problem. And that's the whole point, that cortisol actually is the only hormone that increases as you get older. And that is a big problem because cortisol produces high blood sugar. It actually decreases the functionality of thyroid, and it also decreases the ability for the body's immune system to work properly as well. So when you have this kind of long-term stress, what you're doing is you're functionally changing all your hormone landscape, as well as your blood sugar, your diabetes, and all these different things. So, you know, like I said, our evaluations are very different at the office. You know, we have patients, you know, we look at, you know, specific types of things like, you know, cholesterol, diabetes, and what we do instead is, instead of trying to say, well, now you have a disease, let's give you medication, we try to find those answers beforehand. And that's what I love about our practice, because, for instance, I have a patient who came in not that long ago, younger guy, and this is what would have happened to him, but this is how we've changed his future. He came in because he just wasn't feeling right. His sugar levels were, you know, like borderline, which a lot of times you get glucose numbers and the doctor says, fine, fine, fine. And then 6 months later, boom, you have diabetes, here's some insulin, right? So what we look instead at, we look at the specific hormone insulin. Because if your body is making too much insulin, then what happens is that means that your body is not properly taking the carbohydrates and breaking them down. So what eventually happens is, for people who have chronically high insulin levels without eating, they eventually start burning their pancreas, and the receptors start to not malfunction, and then all of a sudden you have type 2 diabetes. So in our office, we always look at insulin levels, besides for all the other tests, because we look to see, how's your body using this? And, you know, specifically for this guy, the insulin levels when you don't eat should be about 6, just kind of resting around 6. And, you know, his sugar levels were fine in the 90s. We did the test, his insulin level, he didn't eat anything when he did the blood test, were 60. So that means that he chronically walks around with high insulin levels, which eventually is going to burn his receptors and burn his pancreas, and he'll be a diabetic, but he won't anymore because we fixed it. We put him on the right herbal remedies to be able to change it. And today, I'm happy to say, his insulin level was 8 and his sugars went down to 80. So that's the type of things that we kind of look at in the office. So I use this kind of slide because one of my most recent patients came in to me and said, you know, my doctor said to me, you know, she went into the office, she never had any issues before, her blood pressure was high, it was very high, and her doctor said, well, you know, welcome to the club. You know, you're 49 years old, now here's a prescription, you'll have this for the rest of your life. So our ideas are, we reject that type of idea. We look for the markers to actually find the prevention. Then we look for, if there is a problem, how can we fix it? Maybe nutritional, maybe hormonally, you know, maybe sometimes pharmaceuticals to bridge the gap. So we could do all those things to kind of get you over the hump, but our goal is not to just say, here's a script, you'll have this for the rest of your life, and then 6 months later you'll have another script because it's not going to fix anything. So our goals are, basically to, rewrite the future, your future, to transform and take control of your health. Okay, and we look for the markers and everything as far as that's concerned. So we're going to be doing a series with Mosaic, for the next few months, where we're going to be doing a lot of different health topics. Because like I said, Katrina was great when we talked about this. We had exactly the same ideas that we need to move in the 21st century. We need to make sure that people not only feel good, look good, but are good, meaning that they're healthy. And the only way to know that is to be able to test properly, get everything balanced and get everything righted, so you're not constantly going through life. I mean, we look at it and saying that, as you get older, this should be the best times of your life, because if you are hormonally balanced, you'll have the energy, you'll have the health, you'll have the ability to do everything, and you won't have the responsibility of dealing with, young kids. So anyway, so basically that is our discussion, and I'll be here to answer some questions. And Beth is my office manager, wants to come in, and she wants to come and talk to you guys too. Just make
I
it.
have to keep this brief, and I don't know what to say. I just want to give you a background. I just moved here from Rochester, New York, a year ago, right before the storm. Welcome to New Jersey. I left there 30 years. I'm 55, married for 30 years, and raised 4 children, 2 girls and 2 boys with a happy, lovely family. Then we goodbye. I decided what happened to that lovely family. But anyway, so then I decided I'm going to, all the therapy I get, the therapist, mirror the life you want to show your kids. Okay, I'm like, okay, I'm going to do this. I'm going to move back to New Jersey. I've got family here, their support. So lo and behold, I don't know how this happened with fate. Somebody from the office said, do you want a job at this office? And I'm like, sure, I would love a job. I'm sick of helping all these people and being codependent and saying, what can I do to help you, this and that, and I needed something for me. I was bored. Not bored, but I was just in a codependent relationship again. And always taking care of others, and my daughter kept saying, Mom, you gotta take care of yourself. I'm so tired of that. Here you're nurturing these grandkids and giving your heart to them, and they're like, take care of yourself, mind your own business, blah, blah, blah. So anyway, I'm learning a lot at age 55, but so I start in the office, meet Dr. Frankel, and start listening to him talk. And I've been, if you talk to any of my friends, and I have loads of friends up in Rochester, I get this job, and now I'm the office manager. And I've been the crazy woman of Canandaigua, New York. I worked with kindergartners as an aide. I don't want the responsibility of being a teacher because I was so ADD, I didn't even go to school. Because I didn't retain anything. I was just like hyper. So people know me as very hyper, so they're like, oh my God, you're the office manager. Everybody's laughing. And then I sit down at the computer, which I don't know the computer. Windows 8. I'm like, I don't even know how to press. I don't even know how to. My kids are like, Mom, it's just facing your fears. And so these guys are having faith in me. You can do it. You can do it. I'm like, you don't know me. I was telling Michelle, I said, the only reason why I stayed was because they gave me a lab coat that said, Beth Gilligan, office manager. And I was like, now I got to persevere and we got to try this. So I was plugging through and starting to feel a little better because they have confidence and faith. They don't have any clue how this brain's working. And I keep telling Dr. Frankel, I'm very ADD. I have to be told what to do several times before I can get it. I can't read something again. And he's like, oh, I can fix that with hormone therapy. So I'm like, right, I've been ADD all my life. If you can do that, woo, So lo and behold, I get my blood work done, and I get my cream, and I forgot to bring it because I'm a little still ADD, and I forgot my shoes. But anyway, I was going to show you. It's just a little click of this, what I needed, the chemicals, because I was low, and at 55, of course, you're starting to lose everything. Your hair, your brain, everything. And so I decided to do it, and I just put the cream behind me, and after 2 weeks, I don't know, I'm starting to I didn't even realize it, but I'm starting to get clarity in my head, and I'm like, wow, I'm getting more confident. I have a little testosterone because I didn't have any testosterone. So now I'm like one of you guys. So, you know, I'm starting to get the confidence that the guys have. And I'm thinking, wow, I'm feeling pretty good. It's just amazing because my sisters, I just spent the weekend, and they're like, you need to stop coughing that because you're just so, I'm just like energetic, which I've been energetic, but I'm smart too now. And nobody's ever taken me seriously because I couldn't even, my husband used to always say, why don't you go take a communications course? Because I could never complete a sentence. And I said, well, my friends, my girlfriends understand what I'm saying. How come you don't understand? Because my thoughts would just, you know, how we got. So, but now it's all of a sudden, I'm telling you, this is my testimony. I'm not, because I've called my girlfriends up and I'm saying, my gosh, you guys have got to try this because, you know, we never think we're going to be balanced because we're always imbalanced and stressed out and taking care of everybody else and the emotions flying. But I definitely feel different. I'm more energetic. My head feels better. My memory feels better. I'm waiting for the skin. Well, I have to do some muscle, so I'm waiting for all the skin and the rest of the stuff. Not ready for the other stuff that goes with it, but gotta get through my trust issues. But so I just wanted to tell you that it's amazing, and I love working and learning all about it. And I'm trying to get my family. I've got 7 sister-in-laws and 4 sisters, and I got 1 sister on, and the other sister's coming, and I'm like, are you guys, come on you, don't stick your heels in the ground, you gotta start taking care of you, and you're gonna feel so much better. So, that's my testimony.
Thank you, Beth.
I'm gonna say a few
Come on,
words.
Christine. Please, please.
I feel better that she said she's crazy. I'm the other crazy. Very much crazy. And she said that somebody not understanding her. I hope you're gonna understand. I feel better that I've accent, but you will understand me. But anyway, I'd like to express myself about why Mosaic choose to go a little bit different way to work with MD doctor, but not only MD. The point is that 15 years ago when I opened the business, and we realized that American woman never was into the skincare, body care, so much, only nails and hair, like you know, right? And I was very proud that for the last 15 years, we brought that business so high, and we're so busy on the skincare, right, Beatrice? She's my starting girl from 14 years ago that she started with me. She's still 24 years old. And look amazing. Anyway, what I'm saying that being 15 years in business in America, I realized that we kind of right now start blending with other businesses. Because everybody opens salons and spa everywhere. True or not true, but all of us has the same name, salon and spa. Now, and we always was special. We was always unique. Now when the other business start opening, we kind of start blending and people not start seeing us so much, who we all about. Now I decide to, and plus, when I started observing my girls, which when I opened the business I was around 30 years old. I was energizing, not thinking about my health, mostly thinking about my face, whatever. Now, anyway, by hitting and working with girls who is similar age like myself, I realized that it's time to change something because some girls is bouncing off the walls. Some girls has a problem in the families and they don't know how to control. And a lot of people start getting different problems. And, I'm thinking like, okay, what we can do about it? First of all, when I took the new location, one of the girls from my new location in North Brunswick, I realized last year, through the winter time, she's my witness, every other got sick. No immune system. None. Anyway, I decided to have new service at Mosaic Solar Spa. I like to open there. We actually open, I need water. Jenna, give me water. Doctor has to work on my voice now. I don't know, for some reason, I start losing my voice. after 4 or 5 hours meeting with my girls in each location. Anyway, sorry. No, we decided to open the health and wellness. What it means, health and wellness? It means we're gonna work not only on the people from outside, we're gonna work from inside out. I went through the last 2 years through the different meetings with different doctors, and I realized like all of them same. Injection, Botox, blah, 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 whatever. We're not interested about that. Finally, through my friend Tom, he's our website guy. Tom, everybody knows you, right? He's actually creating all our website through the like 10 years, maybe 8 years, and he recommended me Dr. Robert. And when I met with him, I was impressed. I was impressed which way he looked at the future, how would say, future
Of medicine.
medical health or whatever. We don't like personally, I don't like take antibiotics. I don't take any pills. Like, this is Russian guy. Yevgeny. He is actually managing our other part of the advertising, and he can prove that Russian people, European people, we don't like take pills, we don't like take any kind of support from doctor. The moment you read the side effects, it's like garbage, pills and a garbage. I don't take them. And I'm very impressed to hear that Robert said that he is looking for the actual problem, where that problem came from, or whatever health problem you have, you look original where they came from. It's not to fix the temporarily by medication, it needs to find the dilemma. And that's how we European people were looking for original, why the high blood pressure came from, or what do you do wrong, how you care on your life. And that's my goal right now, to teach all my employees first. All my employees has to get healthy. And I told the girls, my main goal right now for next 2 years, make sure that no one girl is not gonna get sick during the winter time. Not. There's gonna be penalty in your location if you, right? Nobody. Now, how we can do that? Because we're creating a relationship with holistic doctors. And secondly, we found a very strong support from the vitamins point of view. Next week, we're gonna have other seminar about the vitamins. Different, it's not regular vitamins, it's different type of vitamins. But right now, I'm not talking about this. But the point is, the combination of everything together, I like to make sure that all my girls never gonna get sick again. If they're never gonna get sick, their kids is not gonna get sick. If the girls is gonna learn how to maintain their life through the doctor, with help of the doctor, which I love him so much. Anyway, seriously, I love him because he reminded me, like, he actually helping me to understand how to live in American life, crazy life, because it's all about work. And sometimes when you're getting crazy, you do not understand why you're getting crazy, right? You like to not sleep, you're losing sleep, you're stressed. And now, actually, I just listening to the presentation, I'm like, oh, that's why I'm getting sometimes crazy in this balance, but I'm healthy. If I go see a doctor is gonna tell me I'm healthy, my doctor. But actually, I'm still healthy, but doesn't mean I'm gonna be healthy in a year and 2 years, right? Right? And plus, I'm not sure, I don't know if I'm healthy from his point of view, all these numbers. But anyway, what I like to say overall, for my girls and for my guests, that Mosaic Salon Spa is going to be right now extremely helping everybody to learn true way how to maintain your body, true way, not to phony doctors, not to who makes money through the pharmaceutical company to boost the prescriptions, because if they prescribe you something, that's their money. That's their money. Company paying them for that. That's why don't sell your soul to the doctors who has like a MD. Doesn't mean he's the true doctor. I feel them, they betrayed us. They betrayed us. They sell us, whole body from head to toe for money. That's why my suggestion, always review our website, which our town friend always gonna make sure the information is there. My marketing girl Monica is here. She's constantly sending newsletter to my customers and employees. Please attend every event. Attend every seminar. Learn how to maintain your body, because you just a little bit away from that. But don't go to the regular doctor. Don't go, please, don't go. You are healthy people. You just have to, if you feel you're not healthy, talk to the first person, this one. Because he's gonna check you from different point of view. But Otherwise, our job right now at Mosaic to not taking care of you only from inside out, we're gonna taking care of from inside out, right? You got it, right, Maya? And oh my God, I'm taking this.
That was well said. Thank you.
No, I speak too fast.
Yeah.
That's why I'm trying to not waste your time. Like,
Yeah.
I know you're very busy. All right, just follow everyone. Thanks.
Thank you, Steve. All right. Well, again, I'd like to thank all of you for coming, listening. I am going to be here for a little bit, and if you have any specific questions you want to ask, I'll be here to answer. We have also some sign-ups for our website, our webinar. We're having a webinar coming out, which is talking about specifically about women's health, and then we're doing men's health after that. So if you're interested in those types of things, just sign up. Just give us your email address, and we'll be able to, get that as well. And thank you. We're in Manasquan, so we're very close by. Manasquan? Yeah, so we're probably about 20 minutes from here. Yeah. You're welcome. Yeah, sure.
After I had 2 kids,
Yeah.
I had 2 kids and I was put on birth control pills because
Right.
this is my hormones are being balanced.
Right.
Like, I took the pills, I gained like 15 pounds, and one day I said, let's throw it out the window.
Exactly.
I started to change my lifestyle. I started walking.
Right.
And then I was good for 2 years,
Right.
and then again I started, after my father passed away, I started going down.
Right.
I got depressed. Things happened. There was a robbery.
Right.
I was night.
Wow, yeah.
Thing. They put me on depression pills, and then January again. I'm like, I had to be strong. Let me join the gym.
Right.
I joined the gym. But how do you naturally produce hormones?
Well, I mean, you naturally produce hormones, basically, from your, women's hormones produced from their ovaries. But here's the thing. When you have a lot of stress in your life, for instance, what happens is that stress hormone actually blocks a lot of the other hormones that you have in your system. So the only way to know exactly what's going on in your body is to test it. Get exactly, you may or may not have low hormones. And if you do, or you might have something, like, for instance, let's say your stress hormone is elevated. What we do is we do things naturally to blunt that effect, and thus that helps to bring the hormones back to natural balance. So, the only way to really know is to be able to, reduce it. So a lot of times what we'll do is we'll start women young like yourself. We could start
I'll
some.
be 50.
Yeah, but a lot of times if you need the hormones, sometimes you may or may not need it for a long.
That's what I was told like 10 years ago when I started premenopause.
Right. Yeah.
They said, oh, you need a hormone therapy. And I
so-
was looking online and I'm like, I don't think I want to get into bigger hole.
Right.
And they put me on the birth control pills.
Well, that's
and
definitely. I would say definitely do not do that.
Yeah,
but
then I threw that.
yeah. I mean, the
that was 5
synthetic.
years ago,
Yeah, the synthetic hormones are just
I know,
bad.
I take the
No, I
hormones.
know.
I just started on pills, and then I don't
Right.
know what, you get tired, I'm like, stop that.
Right.
Then I was put on Xanax,
yeah, so-
anxiety, and then I was put on, what's the depression?
You
called?
sound like a perfect patient for me.
I know, right?
because reality, like I said, and the scary thing is that.
And I started yoga, and then I started the prayer group
Right.
on Saturday.
Right.
So concentration, calming down,
Yeah.
slow down,
Yeah, but the thing is that, like I said, if you need it, we give you exactly what you need back. If and sometimes women only need like
So what
half the
kind-
month.
I have Empire